Good afternoon, good evening. To those on the other side of the world, good morning. I'm Associate Professor Marinos Papiras, and on behalf of the board of the Greek community I'd like to welcome you all to this information session on vaccines and vaccine safety. I'd like to first begin by acknowledging the traditional custodians of the land on which we meet today and pay my respects to their elders, past, present, and emerging. I am the treasurer of the Greek community of Melbourne and the president of the Hellenic Medical Society of Australia, and I'd like to welcome you all to this very informative session that we'll have over the next 60 minutes. The Greek community has been working well behind the scenes with the Department of Health and Human Services, the Minister, Martin Foley, and our Premier, Daniel Andrews, and we're very pleased to have some great content experts here that will try and answer your questions and provide you some information relating to vaccine and its safety. This has all come about as we're setting up a pop-up immunisation hub, which will be located in the hall of St George's Greek Orthodox Church in Thornbury at 66 St David Street, Thornbury. And this is one of the first community pilots where we have a combined community project worked very well behind the scenes by the Department of Health and Human Services and the government to provide access to our culturally and linguistically diverse communities to the vaccine, but also the information on which they may make their decision as to whether they would like to proceed with their vaccinations, whether it be the Pfizer or the AstraZeneca. And what a great time it is for with the announcements that had occurred, because as most of you would have heard yesterday, Victorians are now eligible to receive their Pfizer vaccine between the ages of 16 to 59. They're eligible for Pfizer or AstraZeneca between 18 and 59. And those aged over 60, they are eligible for the AstraZeneca. And to help you understand some of these decisions and the safety, I'd like to welcome Associate Professor Margie Danchin. She is the group leader of the vaccine uptake at the Murdoch Children's Research Institute, a paediatrician of general medicine at the Royal Children's Hospital, a clinician scientist fellow and honorary principal fellow of the Department of Paediatrics in the School of Population and Global Health at the University of Melbourne, a director, clinician scientist pathways at the University of Melbourne, and chair of the Collaboration on Social Science and Immunisation. We also have on our panel, welcome Margie. I'm sure you'll do a great job.
Thanks very much. It's a pleasure to be here.
We're very proud of you. And I'd also like to welcome Magdalena Simonis. She is a general practitioner, a government health advisor, and features frequently in medical media, providing updates for the medical profession. She's a primary care researcher with the University of Melbourne and a leading women's health expert and advocate. Magdalena is currently a member of the National COVID-19 Task Force Expert Committee and was recently appointed the Australian representative for the World Health Organization World Assembly on COVID-19 by the Medical Women's International Association. She holds a number of positions in non-for-profit organisations. She is on the Expert Committee for Quality Care for the RACGP, President of the Australian Federation of Medical Women, Medical Women's International Association Scientific and Research Subcommittee Co-Chair, and Chair of the MWIA Mentoring Group. Welcome, Magda. We're very proud of you too. And as a community, you're obviously one of the Greek-speaking doctors, which makes everyone listening even more proud of you. So I'd like to hand over the podium to Margie Danchin to take us through her talk, which is talking to us about the vaccines and their safety. Thank you, Margie.
Thank you so much for that lovely warm welcome, and welcome everyone tonight to this talk. I'll just share my screen and hopefully these will pop up. There we go. Can you see that okay, Marinos?
Yep.
Is that all right? Yeah,
it looks good.
Excellent. All right. Well, again, thank you for the warm welcome to speak with you all this evening. I think it is fair to say that Lots of people have questions about the COVID vaccines that we're using in the Australian rollout, and my role tonight is to try and answer some of those questions and to provide you with some information, particularly on the safety and the effectiveness on the vaccines, and touch on some of the key issues. But really, I think tonight is about engaging with your questions and addressing what you would like answered, and there'll be a lot of time for Q&A. Before I start, I also would like to acknowledge the traditional owners on the lands on which we're meeting, which for me is the Wurundjeri people of the Kulin Nation, and to pay my respects to elders past, present and emerging. All right, now before I get started, I would briefly like to acknowledge my colleagues. We've been running some of these vaccine confidence training sessions for about 6 months now. And I would like to acknowledge Dr. Jessica Kaufman and Professor Julie Leask and Associate Professor Holly Seal, who also work with me. And this is the group that we're really representing tonight, which is called the Collaboration on Social Science and Immunisation. I'm the chair of this group, and I mention it because it really is reassuring, I think, for you all to know that there's researchers and healthcare providers and people working in immunisation policy and practice, immunisation nurses in the community, who come together within this group to look at ways how vaccines can best be used in the community and how we can have really good high vaccine uptake across the lifespan, all the way from maternal immunisation, childhood immunisation, school-based immunisation, and of course adult immunisation. So feel free to have a look, and if you'd like to join our organisation, you're welcome to do that as well. Now, what I'm going to do is run through an overview of the vaccines in the program, and initially, before I do that, I'd like to touch on the most common question that we get asked around the COVID-19 vaccines, and is that, have they been developed too quickly, and therefore does that somehow make them unsafe? And so this slide is really to show you what is involved in the vaccine development process. And you can see there on the top, the traditional process to develop a new vaccine and all those phases takes about 10 to 15 years. And as we're aware, with the COVID vaccines, it's taken about 9 to 12 months. But what I want to reassure you about is none of the vaccine development steps or phases have been skipped. As you can see, the first phase is really around safety, and that's usually tested in adults, around 20 to 30 adults. Then there's the immune testing to find out whether the vaccine stimulates a really nice, strong immune response, and we test the antibodies in the bloodstream. But then there's the phase 3 clinical trial, which looks at the clinical protectiveness of the vaccine once we give it to individuals, and we see how well it prevents disease. And that's obviously in much larger groups, in groups of around 30 to 40,000 people. And then once our regulators, which for us is the TGA in Australia, get an opportunity to review the data from all 3 phases, and often they review that preclinical data, which is really early on and often tested in animals such as mice. Once they've had an opportunity to review all that data, only then will they make a recommendation for the vaccine to be used in the community or the population when they believe it is safe and effective. And then the 4th phase starts, which is ongoing safety monitoring, which I believe is almost the most important phase, where we're constantly looking at the vaccines in the community and we're looking for any signals around vaccine safety. And I can talk a little bit more about that a bit later. As you can see down here with the COVID vaccine process, none of these phases were skipped. They were just overlapped. And that was because of the urgent nature of the pandemic, the fact that we did need these vaccines quickly. There was huge global investment in terms of the money and the resources put into the development of these vaccines. And a lot of those regulatory processes, the red tape, was just overcome more quickly because it was so urgent. So none of the phases were skipped. The same rigorous vaccine safety and effectiveness data was needed before these vaccines could be approved and used in the community. And of course, we still have really lovely ongoing vaccine safety monitoring. So let's have a look at the vaccines that we're actually using at the moment in the Australian rollout. You can see here over on the left what we call these mRNA vaccines, which sounds a bit odd. You're all probably familiar with that term now. But essentially, these vaccines have a tiny little bit of genetic code. You can see there's that squiggly worm there, encased in a fat bubble, which is called a lipid nanoparticle. And that is actually what the vaccine is. And that vaccine is injected into the muscle. It moves into the cell, and the cell reads that little bit of genetic code to create the spike protein. So here in the middle, you can see a picture of what the coronavirus looks like. And those little black tulip spikes on the outside are the spike protein. So once that little bit of genetic code is read in the cell, then it creates the spike protein and we produce antibodies to that. Then that little bit of genetic code is actually broken down and destroyed, as is the little fat bubble. So there's no possible way that that can be incorporated into your DNA, because within a few hours it's actually destroyed. So that's really important to note, because that's another common question that we get is with these mRNA vaccines like Pfizer or Moderna, which is coming, can that little bit of mRNA be incorporated into your DNA? And the answer is no. But then the next question, of course, is, well, how well do they actually work? And you can see here we've summarised some of the data from the clinical trials, but then more importantly, how well do these vaccines work when we use them in the population? And the key take-home messages here, and I've included Moderna here because Moderna is also an mRNA vaccine, very similar to Pfizer, and we're expecting that in the Australian rollout, and certainly here in Victoria by the end of September. So you can see here in the clinical trials that both of these vaccines were really effective against preventing severe disease. And when we talk about severe disease, we mean your admission to hospital or intensive care, or potentially of dying. So really between 90 to 100% effective against severe disease. And what's really important is when we actually roll these vaccines out into the population, these are data particularly from the United Kingdom or the UK, you can see again between 92 and 97% effective at stopping you from going to hospital if you get coronavirus and you've had this vaccine. So that's really encouraging data. You can see here it's also pretty effective against transmission. And what that means is if you've had 2 doses of these vaccines and you actually could still get coronavirus infection, we know you're not going to get that sick, but how likely are you to pass it on to other people? Well, you're about 40 to 60% less likely to pass it on. And you can see here, and you're all familiar in the media at the moment, we know that the COVID strain circulating in the community is called the Delta variant. How effective are these vaccines against this new strain or the Delta variant? Well, they're also, from the real world data, after 2 doses, really effective against hospitalisation. So 96% for the Pfizer vaccine and about 81% effective for the Moderna vaccine. Now, the other vaccine that we're using in the rollout, as you're aware, is the AstraZeneca vaccine. This vaccine is also contains a little bit of genetic code. This time it is DNA, and it's encased in a killed virus, or what's called a viral vector, which is from an adenovirus. And that's how this vaccine is made. And similarly, the cell reads that little bit of genetic code to make the spike protein, which the body creates an immune response to, and then that little bit of genetic code and the viral vector is destroyed by the cell. Again, the AstraZeneca vaccine in the trials was very effective against severe disease. And then when it was rolled out into the community and in populations, again, 92 to 94% effective against preventing you to going to hospital. And again, reducing your risk of transmitting the virus if you've had 2 doses by between 40 to 60%. And again, with the Delta variant, 92% effective against hospitalisation. So I show you this degree of detail to reassure you that the AstraZeneca vaccine is a very effective vaccine. It works incredibly well at preventing you from getting very sick. As you're aware, the AstraZeneca vaccine generally has a 12-week interval between the first and the second dose. The Moderna vaccine has a 4-week interval, and the Pfizer vaccine has a 3-week interval. So that's just a little bit around how the vaccine obviously is delivered. Now, very importantly, the question that we get asked, number one, is how safe are these vaccines? So it's always important to think firstly about those common local expected side effects that we know happen with all vaccines. So firstly, with these common side effects, these are generally a bit worse after the second dose with the Pfizer and Moderna vaccines and the first dose with the AstraZeneca vaccine. But I show you these data really just to show you how common these side effects are. We need to expect them. And if anyone's had these vaccines, you know you're quite likely to get a sore arm, to feel tired, have a headache or some muscle aches. Fortunately, fever is actually quite uncommon. But it's important that we expect that these side effects probably will happen in the 1 to 2 days after the vaccine. And it's often good to share these experiences and talk about it with your family and your friends so that people aren't afraid. We know that most people just need to take some Panadol or some Nurofen, and very few people need to seek medical attention for these side effects. And you can see over here, this little map, this is that vaccine safety surveillance system that I was mentioning at the start about how we continue to monitor vaccine safety in the community, like these side effects, once the vaccine is rolled out through, general practice or pharmacy and so on. So at the moment, we have about 500 general practices across Australia that participate in this AUSVAC safety system. And what happens is people who get a vaccine with their GP will get a text message at 3 days and 8 days and about 40 days after the vaccine, asking them if they've had any of these symptoms. And that way we can keep monitoring in the community how commonly these symptoms occur. But very importantly, you can see down the bottom here, we also ask people, how often did you actually need to see a doctor for your side effects? And you can see here, less than 1% of people said they had to visit a doctor or go to an emergency department because of these common and expected side effects. So that's really good to know and should give you a lot of confidence about these vaccines. The next question is, well, okay, they're the common and expected side effects. What about the more serious side effects? So the first one we talk about is anaphylaxis, or a severe allergic reaction. And you can see here that anaphylaxis is a little bit more common with the Pfizer and Moderna vaccines than AstraZeneca, but still very rare. We're talking about 5 episodes of anaphylaxis per million doses of vaccine given in the community, which is very, very uncommon. And with AstraZeneca, it's about 1 in a million doses. Now, the other important serious side effect that we should talk about is the clotting syndrome that you're all familiar with now, and that's abbreviated to TTS, or thrombosis, meaning clot, with thrombocytopenia, meaning low platelets. So thrombosis with thrombocytopenia syndrome. And this has only been associated with the AstraZeneca vaccine and a similar vaccine called the Johnson & Johnson vaccine. So those adenoviral vector vaccines that I mentioned before. Now, fortunately, this clotting syndrome is actually very rare. Overall, it occurs, there are about 14 cases per million doses of AstraZeneca vaccine given in the community, which is pretty uncommon. The only risk factor associated with the clotting syndrome is age. So we know that these clots do occur more commonly in people under the age of 60. So you can see over here, for people in that 50 to 59-year-old age group, there's about 2.5 episodes of clotting per 100,000 vaccine doses given, or if you like, 25 per million. And it's a little bit higher in that under 50-year-old age group. It's about 3.4 per 100,000, or 34 cases per million doses of vaccine given. So still a very rare side effect, but that is why the recommendation was made that the AstraZeneca vaccine was the preferred vaccine for people over the age of 60. And you can see here that those risks are much, much lower over the age of 60. So how many cases have we had so far? Well, in Australia to date, after the AstraZeneca vaccine, we've had about 112 confirmed or probable cases of clotting. We've had 6 deaths overall, and there's about 6 patients still in the intensive care unit, and everyone else is either stable or recovering from these episodes of clotting. What's really important to notice, though, in Australia, we've had no episodes of this clotting syndrome after the 2nd dose of AstraZeneca. So if you're in that 60-year-old age group and you've had your 1st dose of AstraZeneca vaccine, you can really confidently go and get your 2nd dose of AstraZeneca, knowing that you are most likely not going to get an episode of clotting, and we haven't seen one episode after that 2nd dose of AstraZeneca so far in Australia. What we do know with the over 60-year-old age group particularly is that these cases of clotting are much milder, the outcome is much better, and certainly now at this point in the rollout, the symptoms that we know to look out for mean that the cases are picked up quicker and people are treated a lot earlier, and that's, you know, essentially why the outcome is so much better. And we can talk about that more if you have other questions. In terms of risk factors, as I said, the only risk factor for clotting is age. It's more common in people over the age of 60. So if you have a past history of a clot in your leg, or you're on blood thinning medication, or perhaps you've had a heart attack or a stroke, you are not at higher risk of getting this clotting syndrome. And of course, it occurs equally commonly in men and women. Even though we have seen more cases in women, that's because it was actually given to more women who were healthcare workers. I'm going to touch briefly on the serious side effect that has been associated with these mRNA vaccines, the Pfizer and Moderna vaccines. This adverse event is an inflammation of the heart or the lining around the heart, and this is called myocarditis or pericarditis. And essentially, we've seen this after the 2nd dose of the mRNA vaccines, particularly in young boys aged 12 or young men up to the age of sort of 24 to 30. This is really an inflammation of the heart, as I said, or the lining around the heart that can occur in the first 5 days, usually after the 2nd dose of the vaccine. It presents with things like chest pain or an irregular heartbeat, maybe fainting or shortness of breath. Fortunately, it's actually quite mild. The young man might need admission to hospital for 3 to 4 days, but everyone has made a full recovery, and there have been no deaths from this adverse event whatsoever. There are some sort of pre-existing conditions that mean you should take care about getting the Pfizer vaccine, which we can talk about, but essentially this is uncommon. Unfortunately, it's a lot milder than that clotting syndrome I just talked about. So just very briefly, in terms of the recommendations, as we know at the moment, Pfizer or Moderna is the preferred vaccine for people under the age of 60. And we know that AstraZeneca is recommended for those particularly over the age of 60. And I would encourage those to come forward for their 2nd dose if they've had their 1st dose. In areas where there is a lot of COVID disease or an outbreak, such as New South Wales at the moment, we have seen that spacing between the doses made a little bit shorter. And that's because we want to increase that protection against severe disease. And we're not so worried about the long-term protection because people can get booster doses down the track. So for example, with AstraZeneca, that interval has been shortened to somewhere between 4 to 8 weeks. And the Pfizer interval has actually been extended a little bit so we can get more 1st doses of Pfizer vaccine into people and protect more people in the community. And of course, we know now that the Pfizer vaccine is recommended for children, adolescents who are aged between 12 to 15 years, who are either on the NDIS, who have listed chronic or underlying medical conditions, if they're Indigenous, or if they live in remote communities. But I think we'll see even as early as the end of next week that recommendation for all adolescents will broaden out pretty quickly. So obviously there are lots of resources out there, and we can send out links. We can put links into the chat about how you think about weighing up the risks and the benefits of these vaccines. And this is always best done with your trusted healthcare provider, your GP or an immunisation nurse. And these are some of the resources that we can share with you later. And on the right, you can see there that's weighing up the harms from the AstraZeneca vaccine in terms of the risk of clotting by age, but also looking at the incredible benefit, especially in the older age groups, in terms of preventing disease, which is shown there in the blue. And this is a lovely decision aid that has been developed for people that can also help them to weigh up, well, what is my risk, but what are the benefits of the vaccine as well? This is often a question that we get asked about people who are pregnant or breastfeeding or planning pregnancy. At the moment, the Pfizer or the Pfizer vaccine is recommended at any stage in pregnancy, and I'm sure down the track, the Moderna vaccine will also be recommended as an mRNA vaccine. These vaccines have been shown to be safe and effective in pregnancy, and it's really important that pregnant women think about having the Pfizer vaccine in pregnancy, because we know that pregnant women are at higher risk of being admitted to hospital, of potentially going to the intensive care unit and having a premature baby. So they really do need to think carefully about having this vaccine whilst pregnant. And similarly, whilst they're breastfeeding or planning pregnancy, we really strongly recommend that they protect themselves. Again, there's some lovely resources which we can share with you if you'd like to find out more information. And just lastly, I'm sure we'll discuss this at length in terms of the vaccines. The COVID vaccines are halal, and they do not contain any cells from aborted fetuses, and they also do not contain any animal products. So just as my last take-home messages, it's really amazing to sit back and reflect that globally, we've actually given more than 5 billion doses of COVID vaccines. And we have this incredible opportunity to not only monitor safety in Australia, but to look at that safety data that's collected globally and learn from the experience in the US and the UK and many other countries. But just to reassure you that actually safety issues are very rare. And that we do also need to be aware that, you know, information and recommendations on how we use these vaccines will change as the pandemic continues, because we need to be responsive to the data. What's happening? Is there an outbreak? How common is COVID in the community? And that doesn't mean that the government got it wrong or ATAGI got it wrong. It means that they're responding to the information and it comes to hand. And I would caution you a little bit about reading and interpreting everything you hear in the media as true. Really go back and talk to your GP, your trusted healthcare provider, about your questions so that you can make the right decision for you and your family to have the vaccine and protect yourself from COVID. So I'll stop there and I will go back to Marinus.
Thank you very much, Margie. That was a great talk, and I think it really hit the important points related to vaccine and vaccine safety. And they're very common questions that we receive in the community relating to the vaccines. And perhaps if I can throw a question to Magda to start with. Magda, when you're at the front line there with your patients coming in, how do you find, what is the biggest challenge in terms of getting them to the point where they're listening to the information that's being provided?
Most people, would you like me to speak in English or in Greek?
English is okay.
English, okay. So most people will come in with concerns from what they have read either in the media or what they've heard from their friends. So usually they'll come in and they'll say, my friend said aku sakati ke muipane, they told me, that this and this and this and this can occur if I have the vaccine. Ke fovame, I'm scared of having the vaccine. I'm here, usually they'll come because the older generation I've found will come to talk to you because they're scared and they want your confirmation that you have access to the correct information, or they want to test out these theories and hypotheses with you. The younger people I've found have been far more open to getting vaccinated, and they're coming in requesting whatever's available. These are conversations I'm having now. So a lot of them have come in saying, well, look, I know what the data is saying. I know that Pfizer is now available. I've had great difficulties accessing it, and I'm willing to have this conversation with you today around having an AstraZeneca vaccine. And so this is a very interesting thing. The older generation, I think, are more fearful of AstraZeneca, and the younger generation are displaying a confidence in science.
Yeah, I think that's our general impression as well. And, one of the challenges, and perhaps I could ask Margie this, is that, do you think the effect of the Delta variant has had an influence at how quickly people process information and how they can process whether the information is true and accurate, or whether it's an opinion piece on the internet?
Well, I think the Delta variant has really shown us just how quickly COVID cases can increase in the community. We know that Delta is a lot more transmissible. So we've seen more cases. Sadly, we've seen more hospitalizations. And of course, we've seen more mild cases in children, not severe cases in children. So I think what's happened is the COVID disease has just become a lot more real again for people. We did experience quite a long period here where there just wasn't much COVID around. I don't think people felt that direct threat from the disease. And I think now that threat feels more real. So, as Magda was saying, we've seen the young people come forward in droves saying, we want to protect ourselves. We want to get out of this. We're sick of living like this and having all of our special life events cancelled. It's having an impact on their uni experience, their work experience, getting married. Young people are saying enough's enough. They're not necessarily so concerned about that severe disease, but they want to move forward. And I think older folks are saying, yep, I want to protect myself against getting really sick. I think where the media comes in is interesting because it can really fan the flames and make people really feel much more threatened and at risk than they need to feel. And so, it's just so good that people are now having those conversations. But as you said, Marinus, people are talking in their communities over their coffee, and they're also speaking to people in their countries of origin, for you, which is Greece. And there's also a lot of misinformation spreading that we need to counter as well.
So, perhaps on that point, Magda, with the understanding of that information that is being sort of transmitted to the community, how important do you think that that's in the language of their origin, if you like, particularly with all, not just the Greek, but with all culturally and linguistically diverse communities?
Oh, it's absolutely important because a lot of the health literacy that we expect people to have doesn't exist in English-speaking people. And we're trying to communicate really complex ideas when you think about this, about herd immunity, about mRNA, about protein spikes. They're hearing all of this information, and then they're being also bombarded, on the other hand, with quite digestible parcels of information in sort of media bits that are scary from, conspiracy theorists. So when you've got simple messages that hit the emotions, and then you have science that's translated rather in almost directly translated from English to another language, the expectation is that people in their own language have a level of health literacy that's rather high. But even in English-speaking communities, health literacy isn't that high. So language has to be in the language that people understand, firstly, in their own vernacular, their regular day-to-day language, not in scientific speak. And it has to be at a level that's pitched to people who haven't done basic science. So we have done basic science and more. And when we write our guidelines, and then when we translate that into patient information, sometimes that is translated directly, and we think that it's simple enough, but it's actually not. So it's not getting there. So we do need community leaders. So webinars such as this are really important for and organising community leaders and church leaders, religious leaders, to speak in the language that the community speaks, and to help diffuse these concerns is really very important. And I think that government websites are trying to achieve that, but they've lagged behind, and the media have been far smarter and quicker in terms of, just always bombarding the public with that updated drama around the changes. And people don't like dramatic change. So they're trying to accept the new information, and then by the time they've accepted and digested it, it's changed again. And that creates insecurity and doubt.
Yeah, so that's absolutely right, Magda. So Margie, one of the challenges that exists, which didn't in the past, or it wasn't appreciated as much in the past, is the role of children. And children that are now obviously becoming infected with this process and can carry this process. Can you sort of elucidate a little bit further about the children, perhaps a little bit on the effect on their health, but also how effective they are to the rest of the family unit at home?
Well, I can really reassure people that, we know that children have been less affected right from the start of this pandemic by COVID, and that is still the case. So even though we're seeing more infection in children, and that's partly because we are getting higher vaccination coverage in the adult population, so the virus is kind of seeking out the unvaccinated groups, if you like, which we know is kids. But the data is still telling us that most of those kids are getting sort of mild infection or sort of a nasty cold at home when they're isolating, but we're not seeing them going to ICU. Some are being admitted to hospital as a precaution. But for example, in Australia, since January this year, so over the last 8 months, we've seen 500 kids get COVID and not one has gone to ICU in the age group under 9. And I talk about that age group because we know that primary school age children and preschool kids are really worrying people at the moment now. How sick are they going to get? How worried should we be? Because we don't have a vaccine recommendation for that group yet. So I just really want to reassure people listening that COVID infection is not more severe in children, but we do need to protect them, and that time will come. And so for the teens, that time is now. And as I said before, expanding to all well teens will happen pretty quickly with the Pfizer vaccine. And I would encourage parents to get their kids protected. And there are sort of 3 main reasons why we need to vaccinate kids. The first is direct protection against getting sick. As I said, fortunately, they don't get super sick. The second is to prevent them from spreading it, and it's mostly spreading it to adults, particularly adults that are at risk. But the third reason to vaccinate kids is so that they can go to school safely. So really, we want kids vaccinated so that schools are a safe place. We want their teachers vaccinated. We want teens vaccinated. And we want lots of strategies in the school to keep the school a safe place. Because as we've all seen, kids have lost a lot of time learning in the classroom with home learning, and that's having lots of impacts in terms of their mental health and well-being and education. So, but generally with kids, the news is still good. They are not severely affected by COVID.
And perhaps a follow-up question on that. The question states that, is there any data on the longer-term effects of that myocarditis in children that are 12 and over that have that reaction to the vaccine, to the mRNA vaccine?
Yeah, no, thanks, Alexa. That's a good question. Fortunately, no. We know that those people who get the myocarditis or pericarditis, those adolescents, are unwell, as I said, for that sort of 3 or 4 days, and they might have a period of recovery in the weeks or months afterwards, but they're all expected to make a full recovery. Sometimes that's complicated if they have underlying cardiac disease or other conditions. So I just want to make that point. But in a well teenager, this myocarditis and pericarditis is temporary, and so far they've all made a full recovery.
Okay, that sounds great. So, Magda, when one of the stories you shared with me is about the more aged or the more elderly that come in with their children to get vaccinated, and how do you find that helps them in terms of making that decision to proceed with the vaccination if they believe in the information?
It's the comfort that they have that they're having what's being told to them reiterated through their offspring whom they trust. And their children come in as sort of the mediator to see, I want mum and dad to understand that this is safe. I've been telling them all along that they should get vaccinated. They don't want to get vaccinated. They're really scared of the vaccine from what their friends have been telling them and what they hear through their circles. So they come in with their adult children often, who are in their 30s, 40s, 50s, and they then hear the story from me through their child to them, and it's a family booking. It's a very nice experience of within the community groups. Like in the Greek community, what I've experienced is if I get my 40-year-old patient to bring in her mama and her baba, they come in, they book an appointment, we sit, we have the conversation, and then I book them while we're there, and we have this this conversation of hand holding, like, these are the possible side effects, this is what might happen, this is what to expect, and in that worst case scenario, which is so tiny, if you have any concerns, you call us or you call the hospital. And so I give them the assurance that, in fact, statistically, they're in a really safe group, and that the outcome of this is that it's going to protect their offspring and their grandchildren and their community. So it's hand-holding.
Yeah, thank you, Magna. I think that's very important, that sort of community or that family decision-making, particularly in the called communities. And now if I can go back to Margie. Margie, one of the things I think sometimes people fail to appreciate is just how dangerous the Delta variant still is for people out there if they get infected without the vaccination. Could you comment on that and perhaps give us a general understanding of how that risk may increase with age?
Yeah, absolutely. So the Delta variant, as I said, is a lot more infectious. So they're calling them the ancestral strains now. So the strain we had last year, the alpha strain, if you had one person who was infected, you might get sort of a couple of secondary cases. At the moment with the Delta strain, you might get between 5 and 8 other people getting infected. So what we're seeing is if one person in the household gets Delta, it's almost up to 80% of the other members of the household will get infected as well, which is concerning, especially in big families. And of course, as we know, for people, particularly those over the age of 50, they have a very high risk of needing to go to hospital for support or potentially to intensive care or even dying. So it is a significant risk, and that of course that risk is much higher if the individual has underlying health conditions. So it's really important that those older Australians get vaccinated. In terms of the kids, as I said before, fortunately, they are still not getting very sick, but they can transmit it to the other members in the household a lot more easily. At the moment, where we're seeing children mostly getting infected is in the household. So it's unvaccinated adults bringing COVID home and infecting children that is most common. So the adults need to come forward and be vaccinated, not only to protect themselves, but also to, particularly for working adults who are essential workers, to not bring COVID home and infect others in the family.
And Margie, perhaps a comment as well, the time period between contacting the virus and becoming infectious is so much shorter.
Yeah.
It means that contact tracers do not really have a great opportunity to be able to prevent that cross-infection that occurs. Would you like to comment on that? Because I think that's one of the things that's been a game changer in terms of how the government's needed to respond to this and how early they've had to respond to try and protect our communities.
Yeah, that's a really good point. And what's tricky about Delta is not only can that period be shortened, in other words, you can get it and be infectious, very quickly, but also it's quite long. So we're having some people who are only testing positive with the Delta variant if they're isolating at home on day 13. So that means there's that potential to get sick quickly, but also to be active in the community and don't know you're unwell and passing it on to everybody else. So Delta is doing both, unfortunately.
So one of the questions is, this is just more of a general question. If you could just explain for Petra the difference between vaccine efficacy and effectiveness. Thanks for your question, Petra.
That's a great question. So efficacy is the term we use for the clinical protection when that's looked at in a clinical trial. So when I talked about that phase 3 clinical trial before at the start, that's where we would talk about the efficacy of the vaccine. Once the vaccine is rolled out in the population and we're looking at real world data, so not in a clinical trial setting, that's when we talk about effectiveness.
And if we move on to one of the other questions as well, there's hesitancy regarding children. Thank you, Patini, for your question, and their vaccination. I mean, that was a great talk, and I think you really hit the high points related to risk and that assessment of risk. But what sort of can you share in order to try and allay some of the fears related to the safety when, you know, the various authorities decide that it's safe for a group of adults, adolescents, or children to have a vaccine?
Well, so far the clinical trial data for kids in terms of how effective the vaccine is in children, the Pfizer vaccine, it's almost 100% effective, which is very rare. So first of all, it works really well. So that's the benefit. And I talked about the benefit of the vaccine before in terms of preventing severe disease, transmission, but also so they can be at school and enjoy their lives. And then on the other side, in terms of the risk, really, these vaccines are really well tolerated by kids. They still can expect those common and expected side effects. A sore arm is common. 80% of kids got a sore arm. About 60% got headache and fatigue, and about 20% fever. So we need to tell kids that. That's what you can expect in the 1 to 2 days after the vaccine. And then the only serious side effect is what I've talked about with the heart inflammation and the lining around the heart, the pericarditis and myocarditis. So, you know, kids are smart. Our teens are clever. I'm a mum. I've got 4 kids. I've got 3 teenagers, and I'm having these conversations with my children and talking about the benefits, the 3 reasons why I think they should get vaccinated, and here are the risks, the common and expected side effects and the more serious one. And they've all said, where can I sign up, mum? So I think it's about being honest with our kids. And I'm talking about the over 12s now, because as I said, we're not expecting a recommendation around vaccinating the under 12s until early next year. So we're not talking about vaccinating primary school or preschool children yet, but the teenagers over 12, have the conversation with them, sit them down, have a chat. There's lots of resources we can share that are being developed by the government and by ATAGI. And if you have questions, then go and talk to your GP.
So one of the other, Magda was talking about this a little earlier, the concept of waiting for a better vaccine, you know, almost like waiting for a better model of car.
Yeah.
How do you go about addressing some of those issues of the here and now as to what may exist in 12, 24 or 36 months related to the risk of infection?
Well, could I answer that quickly from a general practitioner point of view? Because I'm dealing with this every day.
Yeah.
And it's a very interesting conversation to have, because it really is an important concept to get the supply-demand constraints that we're facing across to our patients. So in a perfect scenario where we had X number of X mRNA vaccines and we didn't have a Delta strain that had an R replication rate, that's right, of around 9, then we would probably be able to have a leisurely conversation around this. But given the time constraints and given the rate at which it's spreading, the fact that we have people walking around, as Margie has said, in the community who are shedding a lot of virus and who are highly contagious, if we really want to not overwhelm our health system by, you know, having a sort of a spread of disease in multiple states simultaneously, we really do need to vaccinate people with what's available at the moment. And making that decision is the best decision for now. And we've got enough data from what we've seen from the UK and the US that the AstraZeneca vaccine in the absence or the lack of an mRNA vaccine that's available, is still a really good vaccine to have, and it will be a good option to take where nothing else is available. And that's the type of conversation I'm having every single day and many times a day, so that I can encourage my patients to understand that it is really a supply and demand issue, and we just don't have the supplies yet. And even with the Pfizer vaccines, we're spreading them apart, as Margie has said, to a 6-week gap so that we can get as many first doses in. But then even with the Moderna vaccine, we're waiting into the new year for that, more than likely, to have adequate supplies, or maybe later in this year. But with what we're experiencing in New South Wales, if we want to return to some sort of level of normality where our kids are going to school and having the lives they want to have, and we want to return to work and we want to start socialising again, we need as many people vaccinated as possible, and within a short period of time. So it is pretty much a race now.
So Magda, I agree. And, I had the AstraZeneca vaccine very early in the piece because I thought it was important to protect me. And I think I've had a certain level of calm related to some of the infection issues. One of the issues that's arisen, though, for some of the group chats is the concept of boosters. So, Margie, what could you please share some thoughts about the likely booster regimes that may come in as we move into the future?
Oh, goodness, I froze. Am I back?
Back.
Can you hear me?
Yep.
So in terms of the booster doses, I think it's almost certain that people will need booster doses in the future. But I would encourage people not to worry too much about booster doses right now. Our focus is to get really nice, good, high coverage in the community. We want everyone to have 2 doses that is eligible so that they can have that direct protection against themselves getting sick now. In 6 months' time, we may be dealing with a different variant. We know the companies are making new vaccines all the time. I think when the time is right for us to recommend booster doses for the community, people will know about it. ATAGI, our technical advisory group, our medical and scientific experts who are looking at these data internationally all the time, they'll let us know. So, yep, I'm pretty sure everyone will get a booster dose down the track. Maybe that we all have to have a yearly shot of the COVID vaccine, a bit like the flu. But I would encourage people not to worry too much about booster doses right now, except if they are in a very high risk group, such as somebody who has severe immunocompromise or cancer. Those groups may be offered booster doses a bit sooner. But for most people, I would encourage them to get their 2 doses and they'll be really well protected for now.
A couple of other questions, just maybe some thoughts on it. There was a concern that the vaccines may affect future fertility, particularly in children. Did you want to share some of your thoughts related to that as both someone that understands the vaccines, but also a paediatrician?
Yeah, that is another very, very common question, particularly actually young women concerned about fertility issues. And I can reassure everyone that there's absolutely no evidence that these vaccines affect fertility. There have been some reports in slight changes in the menstruation cycle, or some women experiencing a bit of breast tenderness or enlargement after the vaccine. But in terms of affecting fertility, there is absolutely no evidence. There was some concern that, potentially there was this protein that was responsible for the placenta attaching in pregnancy, and that maybe the vaccine was somehow going to interfere with that and threaten pregnancy, but there's no evidence for that. So I don't know if that was that person's concern. So, I think we can really reassure people there's no evidence these vaccines affect fertility.
And another question, do you think COVID is going away?
No, sadly. Maybe Magda wants to talk about that.
Well, no, it's a coronavirus and it's going to be around for a while. It will probably mutate and hopefully mutate to the point where it will be a bit like the flu that we vaccinate against every year. But where we need to sort of adapt our minds now to dealing with yet another sort of regular vaccine program, perhaps, maybe like we have the annual flu. It might be mixed in. I'm not sure, Margie, what they're thinking. But
I think it will be, yeah.
Yeah, something like the flu and the COVID coronavirus vaccine. And now we know that you can have the COVID vaccine. You know, you can have either AZ or Pfizer and the flu vaccine within close proximity to one another. And in fact, in the States, they're saying that you can even have them together. So they're sort of, you know, they're taking it one step further and saying, well, you know, you don't need to wait at all. So I think COVID is here to stay. Yeah. So
I would agree.
yeah.
With COVID here to stay, Magda, you know, for the people, because there is a lot of misinformation, and there is some people that are quite anxious about some of the information they read through the social media channels. And sitting on the World Health Organization, there is a concern that some of the data is not reported as transparently as it should. But when I look around at the Asia Pacific area, you know, COVID is right, and it's really affecting everyone. Could you share some of your experiences and discussion, informally, obviously, related to some of the experiences in the other countries, and how COVID is a fairly strong entity that is a life-threatening condition?
And it is. And one of the huge issues that the World Health Organization and Gavi and COVAX are considering is the fact that even if we achieve herd immunity in Australia or in our own countries, in our own backyard, we safeguard our own patch, we're not really entirely safe if we're allowing the variants to develop and take over our countries that are neighbouring us and our developing countries that are neighbouring us. So if Australia is safe but Southeast Asia isn't and Papua New Guinea isn't, then really and the virus is taking its own path along in underdeveloped countries, well, we're constantly going to be faced with these challenges. So it is, for the first time in a long time, we're having to really consider not just our own country's well-being, but our neighbours' well-being, and that is being factored into that whole program of vaccinating ourselves and also our neighbours, so that they're catching up, because it's overwhelming Indonesia, it's overwhelming sub-Saharan Africa, and this is where, and when we look at what's happened in India, this is where the Delta strain variant developed. So this is what we're going to have to contend with if we don't simultaneously address the problem on a global scale.
So, Margie, on that point, thanks, Maggie. That was great, because a nice little segue, you know, because Margie, how does the mRNA vaccines, they give us an ability to deal with some of those issues? How do they do that, and how can we trust in them to allow us and give us that ability moving forward to deal with some of the variants once our borders open up?
Well, the technology, you know, these vaccines are going to be updated by the companies depending on the strains that are circulating in the community, just like we do with flu. And that's already happening now. The kind of booster vaccines, if you like, are being developed by these companies. So, you know, I think that's happening as we speak.
Yeah, very good. Yeah, I think so. And the concept of masks, Magna, what's your people, you know, our lives, people feel intruded, they have to wear masks. You know,
Well,
what do you feel about masks and getting out there into the community? Because, you know, there are various thoughts related to the mask, but what are your thoughts?
Well, masks should become our friends, and masks should become a sign of respect for our neighbours and the people that we cross paths with. So it may well be, I mean, most of us have had real problems with wearing masks every day. And we as doctors, I mean, let's face it, we've been wearing them tightly around our faces since February, March of last year without a break. And the only reprieve we have is when we go home to see our families. But the fact of a mask is that it does prevent your own aerosol from being transmitted to other people to an extent. And when we think about aerosol spread with a virus, we know that the aerosol spread for COVID has been a real factor in some of those uncertain cases where how did they catch it. We've seen that that's happened with our hospital, with our hotel quarantine, that hotels aren't really they don't have the ventilation or the air conditioning to support patients who have a heavy viral load. So masks are the way to go. We, in our communities, in our walkways, until we are vaccinated. And then I think that when we have enough of the population who has been vaccinated, which I think we're talking around 80 to 90%, Margie, you correct me if I'm wrong, but until we're vaccinated, it will still be the recommendation to prevent the spread, because even though we might be vaccinated, we can still contract the virus, be asymptomatic and shed to someone who's more vulnerable, who's not been vaccinated. And that's the issue. So we want to prevent that from also happening.
Yeah, Marinus, if I can just add to that, just respond to Nick Dallas's question as well. It's very important, I think, that people do understand that when we talk about, vaccinating 80 or 90%, that's of the adult population, so people over the age of 16. But there's not going to be a magic freedom day where we hit that time point and everyone will stop, as Magda said, stop wearing masks. We're still going to have a lot of those public health measures in place. We may still need the occasional snap lockdown. And as Nick very rightly said, there'll still be pockets of the community that don't have 80% coverage. They're going to be, LGAs, communities, areas where the coverage is a lot lower. But what it does mean when we get to that degree of protection, sort of overall, if you like, in the community, just means that that risk of transmission is a lot less, but we're still going to need those public health measures to keep a lid on it, if you like. I think we're quite a long way off just throwing away the mask and saying, woohoo, we don't have to do anything else. As Magda said, that mask will be our friend in our purse, in our bag, next to our phone for quite a long time yet. I would suggest years.
Mm.
So I think that, masks, hand hygiene, social distancing, respect for the disease. And I think that's one of the things that it's not really something you can see. It's something that you can't see, and there needs to be a great deal of respect to protect you and your family from it, and also your relatives. And when we have public health making decisions that suggest people stay away from their families, it's not because they don't want the families to get together, far from it. It's just to protect each other within the community from spreading it amongst ourselves. So, I think that's a very important point, that we're still not through it. We're working hard towards a solution, and we're working hard towards regaining a lifestyle that we were accustomed to previously. We've had little inklings of it when we've followed the rules, and then we've had a challenge, and there'll be little challenges and obstacles along the way, and we need to, as a group, overcome them. And, if I can reach out to all the people on the webinar and for them to talk to their friends, some of the information today has been very enlightening to me and hopefully to you, in terms of how safe our vaccines are, how transparent the reporting of complications are, and how all of us should strongly consider at least going and talking to our GP or attending our vaccination hubs to be vaccinated. And the government's done a great job in increasing the availability of the vaccines, and this webinar will hopefully help our Greek community and all the surrounding communities in community members in Thornbury to get out to St George's Greek Orthodox Hall in Thornbury at 66 St David Street, Thornbury. Please book online. There's been an overwhelming demand for the vaccines and the vaccine slots there. So please book online, and the vaccination hub will be running between Friday the 27th of August and Monday the 30th of August. So, on that point, I'd like to thank Margie Danchin for her time and for her wisdom, and for your talk. It was a great talk. And for Magda Simonis for all her experiences and sharing them. I'd like to thank the Department of Health and Human Services. Mohammed Mahidan has been a terrific help behind the scenes. He's the head of priority engagement with communities, and Megan Lancaster and all her team. Of course, none of this would be available without our authorities, our Victorian government, coming to the party and providing immunisations. And I found that our Minister for Health and Minister for Ambulance Services, the Honorary Martin Foley, and obviously the Honorary Daniel Andrews, our Premier, have been very supportive of these engagement processes with all our culturally and linguistically diverse communities. So please make the time to either talk to your GP or attend the vaccination hubs, and we can move together slowly as a community into the springtime and protect ourselves from this challenge that we're unable to see, but we can definitely feel once we have it. So thank you very much to everyone that's attended. Thank you very much to the participants for all their questions. And we look forward to seeing you down the track at one of the vaccination hubs. Thank you.
Thank you.
Thanks, everyone.
Thanks, everyone. Stay safe.